side. They kind of have neck pain, some shoulder pain. So just like the lumbar spine, if they don't complain of forearm or wrist, I don't have to clear the wrist. So it's kind of above and below. But if they have symptoms here, I'm going to have to clear the elbow, clear the shoulder, and the neck. Okay? So just kind of like the lumbar spine. And so we're having these symptoms here, and we're trying to differentiate, is it neck, is it shoulder? So we're going to go through all these movements. So go ahead and establish resting symptoms, and let me have you bring your arms forward as high as you can, together at the same time. Good. And then come on back up. Any symptoms with that? No? Okay, so then I have her go ahead and bring your arms forward again. And I will test the uninvolved side first, and then just to be consistent with the other group, then go with the involved side, so relax for me. And then I'll just, so she's quite mobile, so go into flexion over pressure. Okay? And then come back down. Any symptoms with that? Do you have any shoulder issues?
Nope.
Okay. So let me have you raise your arms all the way up for me. So here, I'm not only looking at provocation of symptoms, but I can look at her quality and quantity of movement, especially if I'm suspecting a shoulder problem. You're going to see something happen. You guys haven't done shoulder yet, but you may see them move in a different plane. They may not go in a pure abduction plane. So if they do that, you may want to readjust and say, okay, I want you to go more in this plane of movement and see what happens. Does it make a difference in terms of their pain response? And if it does, then you might be thinking, well, maybe I do have a shoulder issue here. So then again, so to go into abduction all the way up, I do the uninvolved, and then I go into the involved side and go put a bit of almost like an adduction, kind of going towards force. But this is an abduction over pressure.
So they have to relax.
What's that?
They have to relax.
Well, you have them relax as much as they can. I mean, they're in an active movement, but if they're fighting me, I may just say, just try and relax a little bit, and then put the overpressure. Yeah. Okay. Then the bottom one is hand behind back. So I'll have her, do it one at a time. So I'll have her do her uninvolved side. How far can you go? Any problem with that? And then do her involved side. And then come back, and then I'll test her uninvolved just to feel what norm is for her. And then she brings her arm up here, and so to overpress, it's kind of a combination of 3 movements. So I'm going to take her into a bit more extension. Just let me know if you're okay.
Yeah.
And then go into adduction, and then going into internal rotation. Okay. All right. So it's going extension, adduction, and then internal rotation. Okay. So that's hand behind back. What we're trying to do is test the cuff out. Okay? So with abduction, I'm going to have her in about 30 degrees abduction in the scapular plane. My instruction is, resist me. Don't let me push you down. Hold right there, and then relax. You okay? Okay.
So the scaption plane?
Kind of scaption plane.
Okay.
Yes, exactly. Same thing, same plane in the position for external and internal rotation. Scaption, about 30 degrees abduction. Don't let me push you in. And so try to limit your palpation, because if I have my hand here and then I try to push, patients will try to push here again, and I really want to try to push into testing her external rotation. So I'll have my hand here, and don't let me push you in. So I'll put them in the position I want, maintain this position, don't let me pull you away. So hold right there, so internal rotation. And I'll have her arm to her side for biceps, and don't let me push you down, and hold right there. Okay, so those are the 4 static tests. Okay, everyone okay with that? Yeah? Okay. Let me have you, let's have you on your back down here, so head down here. So with the elbow, wrist, and hand, we'll have the patient in supine. So go ahead and bend. Any pain with that? No? And I'll take, so she stays at end range, and I'll just overpress flexion. Now go ahead and straighten your elbow out. Any symptoms with that? Now what I'll do is I'll try and I'll stabilize her glenohumeral joint and her elbow joint here. Because if I try to just test elbow extension, I'm just going to get, especially with someone who's quite mobile, it's going to occur a lot in her glenohumeral joint. So I really want to stabilize those two joints, and then that way I can take her into elbow extension. And I can feel kind of the movement. Doing okay? So that's extension over pressure. Wrist, so flex, kind of bend forward and come back up, go and bend again, and flexion, wrist flexion over pressure. Now bring your wrist back, wrist extension over pressure, or keep it with the palm up, her fingers extended out, and pushing into extension. Now I want you to turn your forearm in towards you. Here, I'll take her and then relax for me, and I'll take her into overpressure. So I'll grab on her distal aspect of her radius and ulnar, and just kind of turn her, force it into pronation with overpressure. And then let me have you turn your forearm out. Any symptoms? And then supination overpressure. And then with hand is grip. So go ahead and squeeze my fingers. Any symptoms with that? Yeah. Okay. What's up, Jeff? I'm going to leave the cervical till later because we're going to do that as part of the cervical exam. But if you're trying to clear the neck, that's what you need to do to clear the neck. Okay. I'm going to leave that till later. Any questions with that?